Hello friends, let us now learn about what do you see in normal T-tube cholangiogram. In normal T-tube cholangiogram, what do you see? Okay. One important thing is in normal T-tube cholangiogram, there is what is actually happening is this is the hepatic duct, then you have gallbladder, common bile duct, right hepatic duct, left hepatic duct, this is hepatic duct, okay, this is bile duct. Okay, this is common bile duct. Okay, now, but when do we place a T tube? It is actually placed after removing the gallbladder. The gallbladder is removed. Now you will put a T tube like this. Okay, now if you send the contrast through this, it will go, obviously by gravity it goes downwards. And if there is no strictures, it will reach the duodenum because this common bile duct will drain into the, it will combine with this common bile duct will combine with the pancreatic duct and it will drain into the duodenum. Okay, because it drains into the duodenum. So obviously now what happens? Where do you see this? So now this will go and drain into the duodenum. So normally in normal T-tube cholangiogram, the contrast media will drain into the duodenum. One important thing. Contrast media drains into duodenum. Okay, this is number one. Number two, this contrast media may also reflect into the common pancreatic duct. It can also reflect. Okay, so you will also note reflex of contrast media into pancreatic duct. Okay, you will see the drainage of the contrast media into duodenum, and you will also see reflex of the um, contrast media into the pancreatic duct. So using this technique, you will see the entire biliary tract is outlined. You can see the entire biliary tract is outlined. So in order to see the rest of the things, you will have to take oblique and lateral view. Through that, you can see the entire biliary tree. Now, this is normal T-tube cholangiogram. Then, when do you see the abnormal T-tube cholangiogram? We also have abnormal T-tube cholangiogram. Okay, this abnormal T-tube cholangiogram. See, if the contrast media, normally this will enter the right. Right. Normally, if you see, the contrast media is entering into the duodenum. But for example, if there is any first, if there is spasm of sphincter of Oddi, here you will have sphincter of Oddi. So if there is spasm of sphincter of Oddi, sphincter of Oddi spasm, or second, if there is some calculus or tumor causing obstruction. This spasm or sphincter of Oddi can be due to the rapid injection of contrast. If we inject the contrast rapidly, then this can result in spasm or sphincter of Oddi. So in both these cases, one thing is this contrast will not enter the duodenum. Will not enter duodenum. So this is failure of entry of contrast into the duodenum. Okay, this is one problem. Then second. Then second. Um, Okay. Now, this is duodenum. Okay. Now, if the contrast media does not pass into intrahepatic duct, so actually the contrast media will also pass proximally, right? The contrast media will not only pass into distally, but it will also pass proximally also, like this. But if the contrast media fails to go in this direction, if the contrast media fails to go proximally, then this is also an abnormal T-tube cholangiogram. Why? It can be due to concretions. It can be due to concretions which are obstructing the lumen or orifice. These concretions which may be present here, okay, proximally, these concretions will obstruct the lumen. Because of this obstruction of the lumen, the contrast does not pass into the hepatic duct, does not go to hepatic duct. Okay, and thus the contrast only goes distally instead of going proximally. So this is one more problem. Second, in this one, if you see, now if okay, now if the contrast does not even go to the T tube, that means if there is no contrast here, this is the T tube, right? Here we have the T tube. If the contrast does not go into the T tube, here itself it is stopped, the contrast. If the contrast is not even going into the T tube, that means one, it can be, there can be some debris which has blocked the T tube. Okay. Number two, the T tube is malpositioned. Malpositioned. That is, the T tube is not in its position. Or if there is kinking of T tube, like the T tube has been bent, and this is causing resistance for the contrast medium to pass. Or if the T tube is outside the CBD, if the T tube is outside CBD, in all these conditions, the contrast media will not enter the T tube itself, enter the limbs of the T tube. So this will also cause failure of T tube drainage. First of all, the T tube drainage, the drain or the bile which has to come out of T tube will not also come out. Number one, and it will also result in failure of the contrast to reach the T tube also. Next, sometimes because of the erosion of small vessels in the tube, or because of vitamin K deficiency, okay, there can be hemorrhage from the T tube. Okay, when you try to inject the contrast, you will see that bleeding is seen from T tube. This will also result in abnormal cholangiogram. Then, if you see this picture where there is obstruction seen in the common bile duct. Sometimes you can also see that there is some obstruction in the common bile duct. That is, it can be due to a neoplasm at head of pancreas, a neoplasm at the head of pancreas, or there can be some chronic pancreatitis, or there can be some calculus in the in CVD, okay, or there can be strictures present in the CVD, or if there is any carcinoma, or if there is any papillae present in CBD. Okay, in all these cases, there is lower CBD obstruction. So in these cases, you will see that the contrast which you see, it will not cause the obstruction. Like for example, if there is a stone or any obstruction here, the contrast will not pass through this side. So these are the different abnormal cholangiograms, YouTube cholangiograms. Thank you for watching.